So the PADMA trial was exactly the first trial, prospective randomized multicentric comparing the palbociclib and endocrine therapy with standard mono-chemotherapy in the patients with metastatic breast cancer. They are hormone receptor positive and HER2 negative. We reported exactly the quality of life with the first line therapy on the endocrine therapy and palbociclib versus standard monotherapy. We had overall 120 patients. They started the therapy. The quality of life was evaluated using the FACT-B questionnaire in both study arms at baseline, at each cycle for the first 6 months, and every second cycle thereafter until the end of the treatment. 101 patients had a baseline and at least one further assessment of the FACT-B questionnaire, and they all were included in the exploratory quality of life analysis. The median time from the baseline to end of the therapy was longer in the palbociclib and endocrine therapy compared with the mono-chemotherapy. And FACT-B, FACT-G, total scores, and FACT-B, total outcome index scores showed significant minimal clinically important differences in the palbociclib and endocrine therapy arm versus mono-chemotherapy arm. That means the FACT-G, the FACT general total score were significantly better in the palbociclib and endocrine therapy arm. Scores on the physical and emotional well-being scales were significantly better in the palbociclib and endocrine therapy arm. However, we didn't find differences in the specific well-being regarding the side effects and satisfaction with the quality of life in the time to deterioration. In fact, B total outcome index between the two arms. Our result showed that combination of the palbociclib with endocrine therapy showed a statistically significant improvement in the quality of life, particularly in the physical and psychological domains, with significant minimal clinical importance difference in the FACT-B, FACT-G, that means FACT general, and FACT-B total outcome index, total outcome score, compared to the mono-chemotherapy. In addition to the statistical significance and clinical meaningful improvement in time to treatment failure and a significant benefit in progression-free survival in the group of the patients with palbociclib and endocrine therapy compared to the mono-chemotherapy indicated improved quality of life, in the palbociclib and endocrine therapy arm, and the next highlights exactly to tell importance of endocrine therapy and CDK4/6 inhibitor as a first-line therapy for the hormone receptor positive HER2 negative metastatic breast cancer.